So I see Deanne joining us, which is good. So we're up to 4 board members.
Hi, good morning.
Good morning, Deanne. We're just waiting for a couple others to join.
See Renee joining now as well.
Great.
If that puts us at 5, I'll plan to start recording right at 9.
That does put us at 5 by my count. So we're
Great.
good.
You're not supposed to get here till 11:16.
And we've got Tyler joining, so we're good to go at 9. So just another minute to let a few more people join. Don.
I'm listening, Don, so I know.
All right, it's 9 a.m. So good morning, everyone. I will call the meeting to order. We may still have 1 or 2 members join us later, but we'll go ahead and get started. First off, I want to apologize for having to miss the meeting in June. I'm happy to report that my wife, Betsy, is doing much better now, to the extent that she and I are on a mini vacation to the Texas Gulf right now, which accounts for my attire, which is probably a one-off thing and not a new normal, but we shall see. Is Christy on the meeting?
I don't see her yet. She did tell me she would attempt to join us for the first portion of the meeting. She's got a few things going on her end of the world, but she was going to try and join by phone. And I don't see Derek yet from KDHE, which.
Oh, okay.
Yeah.
Okay.
He just joined.
Good. Okay.
Okay, good. Well, just to let everyone know, Christy Williams has been appointed to the board by House Speaker Dan Hawkins. She replaces Delise Hofen. Most of you know Christy as a member of the House of Representatives, a former colleague of mine. So we will be welcoming Christy. And I want to thank Delise for her service on the board and her service on behalf of children throughout the state of Kansas during her tenure on the board. So thank you, Delise. We're going to adjust the agenda just a little bit. Derek with KDHE, correct?
Yes.
Cannot be with us the entire morning, but he has an important report, so we're going to insert his presentation at this point. So Derek, I will turn it over to you.
All right. Thank you, sir. I appreciate the flexibility this morning. Ironically enough, I'm at the very last day of the Office of Child Care's State and Territorial Administrators Meeting, otherwise known as STAM. So on an annual basis, we get invited along with DCF. Of course, DCF is the lead agency, but we get invited along with them to come and meet with our federal partners and then with other states as well, and have the opportunity to talk about what's going on in our states with childcare. We kind of get to pick brains from other states and hear about best practices and some of the technical assistance opportunities that's coming from the Office of Child Care. So it was another good opportunity. This is my second time attending, and each one we've learned, we've taken something away. I will mention that I think on this one, we were actually able to give to other states. And so KDHE was invited to be on a panel for licensing as a support to providers. And so OCC wanted us to talk about our engagement with childcare providers across Kansas as a model for other states. And so even some of our neighboring states like Missouri and Colorado and other states like California and Texas were picking our brains yesterday. And it was just kind of a full circle moment, which leads me into the purpose of wanting to give this update to you all as quickly as I could before I head out on my plane back to Kansas. And happy to announce that today is the effective date of our updated regulations. So again, another full circle moment. And just wanted to put the timeline up on the screen. You know, we have some new board members. And so if you're not in the know for what's been going on, we began a regulation review project back in April of 2023 and quickly turned that into public engagement. So we had our first public engagement session in June. And essentially what we did there was we used our licensing database to individually invite every single childcare provider across the state to a virtual webinar. We asked them for feedback. We laid out the purpose of our regulation review, some of the federal pieces that we needed to come up into compliance with, and then some other things too. We talked about, you know, where does the childcare provider want to see us go? How do you feel about, you know, child staff ratios? How do you feel about professional qualifications and staff qualifications? And we got some great feedback from them. We had about 500 providers attend and got some great feedback from them. They, of course, had the opportunity to engage at that session and chat, but then we also had open surveys after. We gave out our cell phone numbers, which is always fun. And we gave out our email addresses, of course, for them to contact us directly. And we got about just shy of 100 survey responses. We came back in July, just there on the timeline there, just a little under a month, had our second session. And by that session, we actually had some preliminary drafted language. And we asked them to give feedback on that. And we really came away from those two meetings feeling like we had a good consensus. We didn't receive any feedback from providers that, you know, caused us to pause or change course or anything of that nature. So we felt good about the consensus that we had reached. I actually have a heat map for the providers that attended, and I didn't send it to you, Melissa, but we had providers from quite literally all corners of the state, and I'm more than willing to share that with the board. We even had providers across state line attend because there are, of course, providers that live in Oklahoma and Missouri that may drive across into Kansas to work. So it was really good representation across the board. And then those two sessions I'll just mention were on weekends. So one of the things with our providers is they're working Monday through Friday. And as I came to learn from them, they're working on the weekends as well because they're restocking for the next week. They're going to the grocery store, they're cleaning, they're, you know, all sorts of stuff, really prepping. So constantly working, but we had 3-hour sessions on a Saturday morning and appreciated all of them attending. Of course, we completed our internal concurrence by September 27th, and then we sent that off to the Department of Administration for review in September, just a day later. Did get approval from the Department of Administration in October, and then we submitted to the Office of the Attorney General on October 9th, and I believe there's another slide. We did get our approval from the Office of the Attorney General in March, so March 19th, we got that final approval. There were a couple meetings in between that timeline there, a little bit of back and forth with their office in terms of answering some questions that they had, fixing a few grammatical things. And it's even simple stuff like, hey, we don't put a period here. We don't, or we do put a period here. What is this acronym? Do you want to use an acronym in your regulations? And so it gets really weedy, fun conversations. So, but appreciated their work with us on that. And then, of course, we had our notice of public hearing. The public comment period begins with that notice. And so that rolls through. You can see the end of that comment period. On June 4th, we had our JCAR presentation in April. And then we finally got publication in the Kansas Register, which is July 18th. And of course, 15 days after that is when regulations take full effect. So that is today. I'll let you all know our implementation plan for our regulation updates. So we've spent the last about 2 months now doing some trainings with our providers and staff as well. We actually started training staff. And you can imagine when you have staff that know some of this stuff like the back of their hands and they've been doing it for several years, and then suddenly you're not only did we change language, but we actually shifted some of the regulations, changed numbers. And so we did some training with staff, and then we've offered training to providers as well. So those have been held on weekends and then on weeknights. We've dedicated those specific to the license type. So for example, a Monday night would be for home providers. A Tuesday night would be for centers and preschools. And we went over their updated regulations, allowed them to ask questions. We asked them for feedback and asked them, if you guys need anything clarified, please put it in the chat. Please send it to us. And we've actually been able to use that feedback to create an FAQ, which we've sent out to our providers via our email delivery system. We've provided that twice now. We sent out the updated regulation books last night. And again, this morning, along with that FAQ. And I'm really happy to say those regulation trainings with providers, we've had over 3,000 attendees in those regulation trainings. So just incredible partnership across the board. There's absolutely a difference between engagement and partnership. And I believe that we have a true partnership with our providers. And that's what I've been feeling, for the last year or so. So in terms of the nitty-gritty on the regulations, we consolidated from 2 home license types down to 1. And so you'll no longer see licensed daycare home and group daycare home. You will just see family childcare home. And so previously, having 2 license types, it caused extra administrative burden and red tape, to be quite honest. They had to fill out an application if they wished to change back and forth between the license type. So having 1 home provider just allows them flexibility, and it cuts down on the paperwork on our end too. So we don't bog down the system and can allow them to operate as needed. So we've of course adjusted some of our child staff ratios. We've adjusted some of the staff qualifications. We account more for experience now in that realm, and it doesn't necessarily have to be in childcare. So we really, when we spoke to our providers, our centers, in our school age programs, we talked a lot about what does that entry look like into the workforce. And of course, this is a complex thing where we've got other things in the realm of early childhood going on with the workforce portal and some of the other professional development pieces that are going on. This is kind of right in line with that, and allowing for better entry into the field by folks that are interested in doing so. I think that about wraps up my comments on the change in childcare regulations. We are continuing to work with our school age programs, and otherwise known as our drop-in programs as well. School age and drop-ins, those are 2 different license types currently. And we're working closely with partners in those realms to, again, submit some more updated regulations through the process. And I think you'll see that here in the next month or 2. We do have some things that are that we have to come up into federal compliance with those, but we've also wanted to create a path to subsidy for our school age programs as well, otherwise known as out of school time. You might hear it as out of school time. So we've been working closely with them and really wanted them to come to the table and tell us, what do you need and what are you seeing? So we want to understand their operations, what they need better. We want them to understand sort of what we have to do from the governmental regulatory lens, and really just have that open back and forth. It's been better for all. So I'll stop there and open for any questions that you all may have.
All
Mr.
right,
Chair, this is
thank you.
Monica. Hey, Don, this is Monica.
Yep, go ahead, Monica.
Derek, thanks for your diligence in looking at this very comprehensive issue in such a coordinated way and recognizing that childcare licensing is not easy. So there's no quick fix. Thanks for including so many people in it. And thanks for always keeping in mind the safety of the children as at the very forefront. One quick question. can you please state or restate, if I missed it, the changes to the infant rate to adult ratio?
Oh, yes, goodness. So in our homes, it's going to be 1 to 3 for one provider and 1 to 4 for two providers. And again, so now with the one license type of, and we've also, oh, Monica, so I
What
apologize.
will it be in centers? Doesn't it go from 1 to 3 to 1 to 4 now?
Yes, yes.
Okay.
It increases in
Thanks,
centers.
Derek.
And
I know all the details are available on your website. We've been sharing them with people left and right. Had questions about it last night. So again,
Yeah.
thank you for all your work on it, and I'll educate myself up on all the details.
And
Derek,
thank
the
you for that comment.
definition of
Yes,
infant.
I was going to mention that. So it gets a little wonky in that homes we don't define those terms. It's age groupings technically, but for the purpose of this conversation, I will just say we moved that youngest group to be younger down to so it allows for a quicker transition into that middle age grouping, I will say. And so in theory, it opens up your slots a little bit quicker. For those, you got your infants and your toddlers and then your older groupings. And so changing those age groupings allows for a quicker transition for the younger kiddos. And then it frees up that infant slot, 6 months quicker, essentially.
And consistent between both home-based and center-based care,
Yes.
correct?
Yes. And it gets a little bit, we did a lot of state-by-state comparison. That those definitions in particular are really difficult to compare state by state when you start talking about ratios, because some states will do 2 weeks through 18 months. Some do 2 weeks through 2 years. And so, state by state comparisons can get a little bit difficult, but we definitely took that into account as well.
All right, further questions for Derek?
And Mr. Chair, if I may, I just want to comment real quick for everybody. We keep a regulation feedback survey open all the time on our webpage, and you all as well are welcome to give feedback on that, or you can always email us directly as well, and we'll be communicating that out to providers. So thank you.
Okay, thank you, Derek. And thank you and all of your team for the massive amount of work went into updating the regulations. We really appreciate the inclusive nature that you went about it, bringing in all of the providers and reaching a broad audience and getting broad buy-in as a result. So thank you for that, and good luck in the implementation going forward. And safe travels back to Kansas.
Thank you so much, Mr. Chair. Forgot one thing, if I may. Just so everybody is aware, when we implement new regulations, it's not a hard stop or a hard implementation on August 2nd. So where we run into areas of education, what we would call consultations, I'll just say we don't expect providers to suddenly know or understand. We truly believe that they all have the intent, that they're all trying their best. And so where we run into issues, for the most part, unless it's a high level safety issue with the kiddos, we're doing consultations to educate and things like that. So there'll be a grace period here for about 6 months for our providers to get up to speed. So, and we've got several other cool things in the works, I think, that's really transforming the landscape. So apologize for the continued comments, but thanks for letting me chime in.
All right, again, thank you, Derek. We appreciate it. Okay, moving ahead. Next on the agenda is adoption or approval of the June meeting minutes. They have been sent out to all of you. Are there any additions or corrections to the minutes from anyone? Seeing none, I would propose approval of the meeting minutes by acclamation in the absence of any objections. Are there any objections? Seeing none, the meeting minutes are approved. Okay, next on the agenda is CB CAP grants, and that will be a joint presentation from Christy Wyckoff and Melissa. Melissa, I'll kick it off with you.
Yep, thank you, Don. It's a pleasure to be bringing you a proposal for community-based child abuse prevention grant awards for a competitive application process. For the first time in 3 years, we did 2 years of renewals. So we just wanted to give a little bit of an overview and remind that this is a federally funded program that provides funding to states to develop, operate, expand, and enhance community-based programs which are aimed at preventing child abuse and neglect and supporting families through education. The focus of the program, the federal focus, is primary prevention and secondary prevention, which means, as you can see on screen, primary prevention is really broad, community-based approaches that just help provide support for parents with young children. Secondary prevention is a bit more targeted when there is a need that is identified, but in both cases, what we are aiming to do is provide support and referrals and education and the kinds of things that can help prevent situations from turning into a crisis where a child is in harm's way. If we could move to the next slide. The philosophy of the program is really intended to be community focused partnerships with local programs focused on child and family well-being. We know that the birth to 5 years are some of the most important developmental years in a child's life. We know that it can be a bit overwhelming when you're a new parent. So we are focused, and the federal program is focused on engaging with families and including them in the process of designing some of the strategies and helping us with the process of implementing and evaluate, and then we evaluate as these programs roll out. The purpose is to build a system that promotes family well-being all across the life course. So this can be programs that help during the prenatal period. It could be programs that help with parent education and home visiting. It's a range of programs and services just designed to provide the kind of support and not leave families in a position where they're struggling to the point where the things erupt into a crisis. Can we move to the next slide? So before I turn it over to Christy, I just wanted to frame, as I said, we did a competitive RFP 3 years ago and then did 2 years of renewals. This is not a lot of money. Our current slate of awards totals $1.6 million from the federal funding. And annually, there is, we have been on the receiving end of gradual increases, but you're talking, a 6-figure increase in the low 6 figures, not millions. So in this round, this was the competitive RFP opened, and we received 25 proposals totaling $5.1 million, almost $5.2 million worth of funding. We have created a slate based on the prior year federal award amount, so 1.6 million. We had a little bit of carry forward from last year. The feds give us extra time. This is money that went unspent last year, so we've added that in, which you consider one-time funding. So we've gotten to 1.8 million to award pending our new award from the federal government. So we typically don't hear until September, and we certainly won't this year because Congress still has to do their budget work. So any recommendations that we land on today will be pending congressional budget approval and the formal notice of award from the federal program before we actually engage in the grant agreements with the grantees. But I'm going to turn it over to Christy to walk you through process and the applicants, and then we can open it up for questions.
All right, good morning, everybody. So I'm just going to go through the timeline of the RFP process and the review process. So on May 21st, we opened up the Kansas Common App portal where they submit their applications and release the RFP to the public. And then on May 25th, we had a technical assistance webinar was held for the applicants. And then on June 20th, we held a technical assistance webinar for the external reviewers that had agreed to review these applications for us. On June 28th, all the applications were due at 5 p.m. And then July 1st through yesterday was the review period where the external reviewers were able to review all of the applications, which were all reviewed by at least 2 reviewers. And then we had the hard work of providing, putting together a slate for you all with all the proposals we got and the limited amount of funding that we have. So, and then whatever is approved today will begin on October 1st. And then the grant year will be October 1st of 24 through 9/30 of 25. And that is all pending, like Melissa said, our federal grant award that we will normally receive mid to late September. But you never know. So next slide, Lindsay. So some of the technical assistance that we provided during the period of the open period of the RFP was questions related to the RFP. They were submitted through a form, and we answered all those directly via email, as well as any actual technical support that was needed with the Common App website. The webinar training that we did for the applicants as well as the external reviewers all went through the RFP and talked about the philosophy of Kansas CBCAP. And then we posted that for the applicants on the CBCAP website, which is on the Children's Cabinet webpage. And we emailed that out to the external reviewers, their webinar to them for those that couldn't attend. All right, so this is the slate we are recommending for funding. All of these proposals focus on primary or secondary prevention and at least one special population as required by the federal award that we receive. Special populations can consist of like racial and ethnic minorities, children and adults with disabilities, families experiencing homelessness, adult or former victims of child abuse or neglect, fathers and male caregivers, and then or parents and caregivers at risk of experience substance abuse. There's a few others, but that is what the feds consider special populations. All of these also align with our Kansas CBCAP philosophy around the blueprint for early childhood, and they all focus on families with children from birth to 5. We are recommending 6 proposals, which are marked in your pre-prep email that was sent out in the PDF. Making 6 proposals from current annually funded CBCAP grantees and 2 from grantees that were funded with ARPA dollars, and then 1 new proposal. I will say there was 1 ARPA funded grantee and 1 annually funded grantee that we are not recommending funding for this year. And then I'll let Lindsay go to the next slide. To talk about, these are the applications that we received that we're not recommending funding for. It was very competitive. Lots of hard decisions had to be made because there's literally $5.1 million in requests, and we're estimating that we possibly may have $1.8 million available. So that leaves a $3.3 million gap, which is why it was made so difficult. And none of the awards that we are recommending fully fund any request unless the request was less than what the grantee, any of the current grantees had received for federal fiscal year 24.
Can we flip back to that slate?
Yeah. And you won't see that difference on here, but it is in the PDF that was in the prep packet, where it shows their federal fiscal 24 amount, their requested amount, and then the amount we're recommending for funding.
Do you want to flip to the map, Lindsay?
All right, so this is for the proposals we are recommending for funding. This is the service areas that they would cover. I would like to go over the new grantee and what their proposal consisted of, as well as the two grantees that were funded by ARPA dollars the past 3 years. And we are recommending to move into annual funding because those ARPA grant years are ending. So we'll start with our new grantee. It is the Barton County Health Department's Family Crisis Center, and they are right there in the middle with the big star on the map. They actually had the highest external review score out of all the applicants. And we were just excited that this pushed CBCAP funding, more towards the western side of the state. This was the farthest west of any proposals we received. So we're excited about that. They are going to offer home visiting, case management, and parent education workshops to prenatal, postpartum, and teen parents, as well as mental and behavioral health for families that are receiving case management services. They're going to offer that at a free or reduced rate, which will help parents with behavioral supports. They're also going to do school and community trainings for personal safety awareness to child care providers across the county. The ARPA funded grantee one of the ARPA funded grantees that we're recommending to move into annual funding is the Lawrence and Douglas County Health Department. They're going to be that blue shaded Douglas County on your map. And their program is called Mi Apoyo Prenatal, which means My Prenatal Support. They coordinate with care providers in the community to offer care coordination and case management. And this is for moms, prenatal moms through the child's 12 weeks, first 12 weeks. And then they refer those moms and that new baby to Healthy Families America home visiting program within the county. They also do Comenzando Bien, which is their Becoming a Mom, small group parent education, that they go over prenatal care, health and nutrition, safe sleep, smoking cessation, infant nutrition, breastfeeding, and postpartum recovery. And then the last grantee I want to highlight is the Southeast Kansas Library System, and they are those dark blue counties in Southeast Kansas there. Their application actually proposed expanding to 10 libraries and 2 other regional library systems. We are not, like I said before, recommending to fully fund their entire request. So we will work with them, whatever is approved here today. We will assist to expand to as many of those libraries as possible, depending on the amount of the award they receive. The libraries eligible to add this program will be chosen by a panel of parents that have been involved with the program in prior years, as well as librarians helping implement the program and youth service consultants employed by the regional library systems. They will train the new libraries at an initial kickoff event and monthly trainings that they will be required to go to. The trainings will be organized by the Kansas Child Care Training Opportunities, or CACITO, as we know them by sitting in all of our early childhood meetings. And they will assist in building a slate of courses appropriate for individuals working with young children. They'll also have training for the librarians by Dr. Bobby Long from Emporia State, who has done research in serving underserved populations in public libraries. And there will be other professional development opportunities around this work as well. Their program consists of weekly story time events at participating libraries where the librarian will model strategies to build early literacy skills and provide opportunities for families to practice these skills during story time. And then also monthly stay and play events where they will bring in speakers from a community organization that targets services to families with young children, like Head Start, Tiny K, and Kansas Children's Service League. The program offers opportunities for children to develop social emotional competence and provides family-friendly play spaces and opportunities for social interaction through play. So those are the ones I wanted to highlight, since those are the ones we are recommending to move into annual funding, as well as our new grantee, our new applicant proposal. And that is, I will open it up for questions.
Let's see, put the slate slide back on screen for the purpose of discussion. Perfect.
Okay. Thank you, Christy. I actually have the first question, if that's okay.
Sure.
So a very competitive process, roughly $5 million of requests for 1.8 million of funding. You funded 9, you had 25 applicants. So there were 16 who did not get an award. And you say that the applications were very competitive, so a number of those did nothing wrong. So what was the yardstick you used to decide this one will be funded and this one just didn't quite make the cut? Was it a matter of bang for your buck, or was it a matter of an incomplete or imprecise application?
If I may, I would say it's a combination of factors, Don. It starts with a preliminary screening. Is the application applicable to the program criteria? And we did have there usually every time we have a competitive RFP, people apply with proposals that would be great, but aren't hitting the nail on the head for the grant criteria, the RFP criteria. So our focus is families with children birth to 5. If an applicant is serving a high school age population, it may be a really worthwhile program and a well-written grant, but it isn't in the focus area. So when we are having to sift through and make this kind of decision where we have a fraction of the funding requested, that will weigh pretty heavily. We also want to make sure that we expand the range of services and the reach of programs as far as we can. So we do take the geography of our grant making matters, the strength of the applications matter, and just a host of things. For any RFP that opens up that's competitive, there's always a concern about existing grant recipients who are reapplying. there are factors related to compliance over time and participation in our common measures initiative and a whole lot of things that we weigh as we are making these difficult decisions. So the hard part is when we see worthy applications and we can't spread the money across everything that we would like to. And I would also say the most of the recommended awards are less than requested. The only ones that got the amount they requested actually requested less than they had been getting in the past. So there's more work that could be done within this slate, and there's certainly more work that could be done with a broader slate. I don't know what we can expect from the federal program in terms of increase. In years past, it hasn't really been enough to bring on board additional applicants. We have used it to level up the awards from the slate that we have approved, but it's hard when you can't anticipate. The formula used federally to do this starts with a population-based distribution, and they factor in. I am not capable of explaining the federal process for awarding this funding. It is tough to. They have their methods, so it isn't a predictable. If Congress increases by X amount, we will get X amount more. It's going to be a surprise when the federal award happens.
Okay, well, thank you, Melissa, for that good information. Appreciate it. Questions for either Melissa or Christy?
Hi,
See-
Renee Erickson. I do have two quick questions. One, I'm looking at the project abstracts, and they note many different programs that these agencies and organizations are using. Did they provide any data as to the efficacy of these programs at all? Was that just...
That is part of our ongoing evaluation process. So we do get assurances for the partnerships that are included in their grant application, and then our annual accountability process, the Common Measures Initiative, the reporting that we provide to the cabinet helps determine the impact these funds have been having. So yes, we track that very carefully.
Okay, thank you. And then my second question is, in looking at the program or the project abstracts, I was looking at the Lawrence Douglas County Health Department. And if you guys did this earlier, I apologize for not catching it, but it says that they provide support prenatally through the 4th trimester, and newly enrolled birthing persons are supported through care coordination. So I guess I'm old enough to think there were only 3 trimesters. And so someone help me with 4th trimester and birthing persons, please.
4th trimester, I think, is the lingo used to talk about the first 3 years of the infant's life, because for a mom who's just given birth, that postnatal period is a period where moms are going through. We all know, those of us who've had kids, that there is a period of postpartum readjustment physically and emotionally. And so the 4th trimester encompasses programs that support both the new mom and the new infant.
And you said
I'm
3
gonna jump
months,
in there.
Melissa.
Yeah, 3 months.
It's 3 or 12 weeks, 3 months. You said
Yeah,
12, 3 years. I'm sorry.
Oh, I'm sorry. Yes.
That's okay. I wanted to clarify.
Thank you for that correction. Yes.
And then birthing persons, is there a definition that they provided for that?
So yeah, they get support. They support the family through the birth cycle. And they just they have a care coordinator and a case manager that just make sure that they are connected with a doctor, a care provider through this period. And that's what that care coordination / case manager is.
So
Oh, that's the birthing person is the care
the person
provider?
the person who gave birth to the child. The program abstracts that are in your package are the program abstracts written by the applicants. So with the word choice used is theirs.
Thank you.
Yes.
Mr. Chair, if there's no more questions, I would move to approve the slate as provided.
All right, you've heard the motion. Is there a second?
Tyler Smith, second.
Thank you, Tyler. There's been a motion and second to approve the CBCAP funding recommendations. Is there any discussion?
Tyler
Seeing
Smith,
none.
sorry. Tyler
Go
Smith,
ahead.
just a quick question for with the recommendations, especially for those grantees who might have either received a grant in the past but now will not receive them, are people encouraged to apply again in the future, or how does that process work?
Absolutely. People can apply. We will have a competitive RFP for the early childhood block grant, which opens later this year. We don't exclude people from reapplying. We do our best to help ensure that programs have the opportunity to apply for our funding. Yeah, I mean, this is hard. This is the hard work of grant making when resources are finite.
Thank you so much. I appreciate that.
Yep.
All right, thank you. Any further questions or discussion? Seeing none, we'll proceed to a vote. Can we do this? Okay, roll call. Dr. Tyler Smith.
Yes.
Terry Rice.
Terry's not with us.
Monica Mernan.
Yes.
Deanne Owen Graham.
Yes.
Dr. Leetta Felter.
Yes.
Senator Renee Erickson.
No.
Representative Christy Williams. And Chair Don Heineman, yes. And the motion passes.
Okay, thank you.
All right, next item on the agenda is the 2024 All In for Kansas Kids Strategic Plan. Melissa.
Thank you, Don. The prep email that we sent you included the strategic plan, the All In for Kansas Kids strategic plan that we have been working on for the last year or so. Earlier this year, you received the updated early childhood needs assessment. We use the findings of that needs assessment to proceed to update the All In for Kansas Kids 5-year strategic plan, which we adopted in February of 2020. This is all work related to the federal preschool development grant, Birth to 5 grant funding that the cabinet serves as the lead, the state lead administrator for. So we have been tracking since 2019 needs and building strategies to address those needs through a partnership that includes the Children's Cabinet, the Department of Education, Department of Health and Environment, and Department for Children and Families. So the 4 Kansas agencies have been partnered in all of the work. And we are really pleased to roll out the updated strategic plan, which reflects progress made to date with the portfolio of work and progress towards goals, and the vision for the next 5 years to help guide our work. I would pause and just remind that having done the comprehensive statewide needs assessment work in 2019, and then turning that into the strategic plan ahead of the onset of the COVID-19 pandemic, actually gave us a framework from which we were able to come together to do the emergency planning and response to the situation childcare providers and other providers of early childhood services found themselves in with the public health emergency. And to keep us on track, even as we were dealing with roadblocks and complications, we still were able to use the baseline understanding of where we were and ongoing needs assessments. We did 2 updates during 2020, and then we did the first pandemic update, and then 2021 we did another. So we were able to keep tabs. We were able to both address emergency situations as they arose and support parents and providers through very difficult days, while also maintaining an eye on the goals that we had put in place, the vision for the future. So this has proven to be of benefit in many different ways. There was an influx of federal pandemic relief funding. We were able to plug in ways that kept us above water, treading water above water during a period where we might have seen a lot of backtracking on progress made. The work always includes extensive public feedback and opportunities for input. We collaborate with external partners in the private sector, other all of the agencies are at the table. The organizations that support the work in our realm have a seat at the table, and we create that there is co-creation involved with the drafting of all of these resources. So it's a very big thank you to our agency partners at KDHE, KSD, DCF, the staff in our backbone support team at the KU Center for Public Partnerships and Research provide the grant support for preschool development grants. And so they really help make us all look like we know what we're doing. And the commitment that all of these agencies and organizations bring to help in the quest to better align resources and enact things that carry the work forward is something that I just want to acknowledge. This is a grant deliverable, as I said. So what I want you to be thinking about as we walk through what the content of it is your role as the designated state early childhood advisory council. We had you accept the needs assessment earlier this year as the official final version. We're asking you to do the same with the strategic plan. If you are willing to adopt it, we will then be able to turn this in to our federal project officer and complete that section of our grant. And it will, of course, be posted online for anyone to access once approved. Lindsay, you can move on to the next slide. So I just want to reset. The strategic vision is that every child thrives. To us, this means that all children will have their basic needs met and have equitable access to quality early childhood opportunities so that they're prepared to succeed in kindergarten and beyond. We know how important those early years are for child development, and we just want to make sure that children have the opportunities that will help nurture and give them the best possible start in life. Now we can move on. So the strategic plan begins with a commitment statement. This is the 4 partnered agencies coming together. It's a letter that just documents our commitment to the work and to the goals of the strategic plan. The next section frames the importance of early childhood and it addresses the findings of the needs assessment. So we give a bit of a summary and we really put the framework around what it is we see as important for our children's future in Kansas. We then break the goals into 3 sections. 3 pillars are the Kansas early childhood ecosystem. Well, we'll get to that in a minute. We have 3 pillars. There's a total of 15 goals, 111 actions, and then a variety of indicators of progress. We've tried to note what success will look like, how we will know if things are working better with all of the actions proposed. Now we can go to the next slide and we can talk about what we mean by the early childhood ecosystem. It's anchored in the blueprint for early childhood, which is the 3 pillars of healthy development, strong families, and early learning. Those have been the cabinet focus since long before my tenure started. The cabinet early on adopted the blueprint as the document to help direct the investments made with the Children's Initiative Fund. So you'll see it better in the plan than on the slide, but that ecosystem infographic shows you a variety of service areas that are provided by the 4 state agencies involved. And it really is cross-sector and comes from funding to support them comes from multiple sources. But these are the things that we know matter and are supported when the community comes together to support young families. So it's a whole range of resources which we talk more about throughout the plan. So we can move on. The plan itself has the 3 sections you see on screen that speak to the Kansas early childhood ecosystem itself. So that section really speaks to work that we as state agencies and programs have the ability to impact. It includes state collaboration with local entities to meet child and family needs. It involves getting communities connected to be able to engage with families to offer the right resources at the right time. It speaks to how we use data to measure the impact and use that information to improve programs and investment strategies, and how it's strategies for expanding available resources to increase capacity. So it's things like expanding and reaching out to include public and private sources of funding partnered together. It's strategies internally. How do we align our work and make sure we're avoiding duplication and maximizing existing funding to the extent possible, things like that. The next section speaks to the Kansas early childhood workforce. This has to do with strategies to improve compensation and financial stability for providers, to help in the goal of recruiting and retaining good quality people working in the profession. Prioritize the professional development and advancement opportunities, help grow that workforce overall to increase capacity and improve the quality of the early childhood environments for children and their families. And then finally, the section dealing with children and their families. This is a really important component. This pillar speaks to engaging families in the process of including their lived experience as feedback to help us better plan, to prioritize the well-being and the mental health of children and their families, to invest in helping meet the basic needs of families with young children, and to help families make informed decisions about and have better access to the services their children need. So this is resource and referral. This is just a whole host of things that we invite families into the process of telling us what they need. We can move on. There is a section that addresses pathways to action. What are opportunities? It isn't just the state. This plan is designed for anyone to find ways to inspiration for ways that they can be a positive influence and help us in this work. So we don't. This is work that really belongs to all of us. So the state level opportunities include a variety of different teams that exist, committees and advisory boards and different ways that people can engage. So at our last meeting, you all approved a slate of people to serve on the Early Childhood Recommendations Panel, which is our standing committee in our role as the State Advisory Council. There is a family leadership team. The Family First Prevention Funds have a family advisory board. Child Care Systems Improvement Team, the State Home Visiting Leadership Team, the Maternal Child Health Council, or there's a whole range of others. There's local interagency coordinating councils, the State Interagency Coordinating Council. There are a long list, not named on this slide, but it's opportunities for families and providers and the community to engage in the process of planning and then we do address how people might take action locally. And we have been supporting community-led childcare coalitions across the state. Childcare Aware is leading that work as a outside partner, but trying to build coalitions that support the community needs related to childcare. I mentioned the local interagency coordinating councils, family resource centers, parent engagement groups. There's a whole range of ways that people can step in and help us. So we are trying to provide that framework and inspiration for people to figure out how to join the effort. Next slide. And finally, we conclude with a section that speaks to how strategies for maximizing investments. So strengthening private sector partnerships, utilizing flexibility with federal funding to optimize the impact. That means braiding funding from multiple sources when we can. The Child Care Capacity Accelerator is a beautiful example of the way we've been able to do that. And through our agency partnership, we are definitely collaborating on ways that the various funding streams can have maximum impact. And then just, ideas for making strategic state level investments that leverage the local side and boost sustainability. So you all have had a week to access the plan, and the slide just emphasizes that this is for all of us, not just us at the state level, but this is why we call it All In for Kansas Kids. So I'm going to stop here. I would like to open it up for board discussion. Any questions that you have, I'd be happy to entertain.
All right, thank you, Melissa. Discussion. Input from any board member? All right, seeing none. Melissa, any follow-up remarks?
No, this has been a labor of love. There's a lot of time and a lot of hours invested in this work. And it's something that we hope is useful and helps guide decision-making in a whole lot of different sectors. So, Dawn, I think what I would appreciate is knowing if there's any objections to the adoption of this strategic plan.
Okay. You have heard the request. Are there any objections to adoption of this plan? If there are none, I propose that we approve it by acclamation. So if you have any objections, any questions, please speak up. All right, seeing none, I declare the recommendation approved by acclamation.
Thank you.
Agenda item 5, Early Childhood Advisory Council recommendation. Melissa?
Yep. So we've mentioned already this meeting, the Children's Cabinet serves as the official state Early Childhood Advisory Council. That is a designation that was done with Executive Order 2002. It's a federal requirement that every state have such a council to comply with federal Head Start legislation. So the federal rule requires certain members of the advisory council have specific affiliations and expertise. This board does not have that as a group of voting members. So the executive order directed us to set up a standing committee, which is known as the Kansas Early Childhood Recommendations Panel. Just wanted to revisit that the panel exists to bring us recommendations for the Early Childhood Advisory Council to adopt. And we view this as it is a work in progress. There are working groups on the panel that have specific project areas they focus on. They choose them themselves. It's based on the activities outlined in the strategic plan. So they'll pick a goal area and workshop how we might best address it. Lindsay, can you go to the next slide? You all received a recommendation from this group for the adoption of 2 resources that constitute tools that employers can use to better equip their workplaces to be family friendly, to help their employees. This is really a response to the adoption, the increase of the Kansas business childcare tax credit. A year or so ago, the legislature expanded eligibility for that tax credit. And there's just been a lot of questions from businesses across the state of what constitutes compliance. So these are not tax guides. I don't want to suggest we are giving tax advice. We still would advise any business owner to check with their tax preparation professional to see. But these are strategies. The Family Friendly Workplace Guide is a guide to different strategies that an employer can choose to implement it as appropriate in their place of business. And then there is a survey tool that Kansas Children's Service League, through their Kansas Power the Positive program, has adopted and has used with businesses interested. It's a survey for the employer to use to survey their own employees to determine what their employees might be interested in having, to make it more family friendly. This action, this recommendation, does not mandate a thing. This is merely putting a toolkit in place that we will make available online as resources that interested employers can access to help guide their decision making. So you have a little more detail in your package about the rationale that lives behind it, and the content. I will tell you that this has been probably a year in the making to hone in on what might be most useful. And this working group has been extremely committed to this. And there are ideas for ways to help make this information available. They have asked for outreach to the departments of labor and commerce to make sure that business leaders and employers have access in arenas where they might not be thinking about early childhood otherwise. So I don't want to belabor this. I do want to give you time to ask questions and make any comments. It looks to me like we have Dana Book from KCSL on the call, who served on the working group. We just asked that she, we're appreciative that she joined us in case there are questions about the work that went into this that I would not have the answer to. So Don, we can open to board discussion at this point.
All right, thank you, Melissa. Board, any discussion, any input?
Mr. Chair, it's Monica. I just want to say thanks to everybody who worked on this. This is so in line with other things I've seen and so needed, and really a lot of detail in here. So thanks to all the volunteers who brought this to us.
Well, I would just emphasize that I really appreciate the work that the panel went to in putting these recommendations together. I think it's important to reemphasize that they are neither mandatory nor regulatory in any way.
Nope.
They're just put out there as toolkits, as resources for employers to use as they see fit. And I think that's very, very helpful. Any further discussion? All right, seeing none, we will proceed to vote. Tyler Smith?
Yes.
Monica Mernan?
Yes.
Deanne Owen Graham?
Yes.
Leetta Felter?
Yes.
Renee Erickson?
Yes.
Christy Williams?
I think she maybe had to exit.
Okay. And Chair Don Heineman votes yes. And
Mr.
the
Chair,
motion is yes.
did we have a motion?
We did not have a motion. No, we did not. Let's back up.
Sorry.
I would entertain a motion from a member of the board.
So moved, Tyler Smith.
Second.
All right,
Monica
thank you.
Mernan.
Is there a second?
Monica Mernan.
All right, thank you. We will proceed
Point
to
of order.
revote.
Point of order, are we just moving to pass the recommendation?
Yes.
That's correct.
Okay, just making sure, just for tidiness. Thank you.
Yep. Tyler Smith,
Yes.
Monica Mernan,
Yes.
Deanne Owen Graham,
Yes.
Leetta Felter,
Yes.
Renee Erickson,
Yes.
and Chair Don Heineman votes yes. The motion is adopted. Thank you all, and I apologize for my misstep. Okay, moving ahead to agency updates. First up is Matthew Billinger from Department of Corrections.
Good morning, thank you. We are excited to announce that we're releasing, or have released actually last month, innovation grants, also being called rolling grants for reasons you'll find out. These are a little bit different for the department, as these grants are targeted to both juvenile supervision agencies as well as community partners and organizations. Unique in that those community agencies can apply directly for these grants, whereas many of our others have to go through community corrections or advisory boards. In addition, they're going to be available year round. So this is something that took a lot of work on our part. At least it was new for us. Traditionally, our grants have a 2-year cycle and you have a small window to apply for them. But this opportunity is available year round. So once a quarter, they're being awarded. So you can apply at any point across the 2 years, and that money is awarded on a quarterly basis. And those grants will keep going until the money runs out, and we were able to secure $50 million for this. So we're hoping to get a lot of money into the community for the programs. The population that's being targeted is those that focus not just on juvenile justice involved youth, but also the youth and their families, youth experiencing behavioral health crisis and their families. So this kind of opened up the window to where it's not just justice involved youth, but it came about from legislation last year to target youth that are at the risk of being justice involved. So a little bit of prevention type stuff. So again, we've had a few flyers and information go out, and we can resend that if anybody's interested. But we're really working to get some of our reinvestment funds pushed back into the community for that. So this is a new step for us. It was quite the leap for fiscal to take this on and do it this way. So we are working through some challenges, but we've already got a couple of them out the door already. So we're excited about that. In the past, I've spoken, I'm sorry.
No, I just was going to say that's very nice.
In the past, I've talked about our Stepping Up initiative. So this is initiative working towards youth and giving a more holistic approach about addressing the needs of youth in the areas of behavioral health, substance abuse, cognitive challenges, and criminogenic needs as well. A lot of the agencies on this call are represented in that Stepping Up initiative, but they have taking more leaps and bounds, trying to get something going. They have a core task force that's meeting regularly and working on a strategic plan to get that implementation going. We did have a step back on our juvenile defense initiatives. So the Juvenile Justice Oversight Committee is working with the Galt Center and trying to improve, standardize, provide more resources in the juvenile defense area. However, many of the members that they targeted for that are also out campaigning because of the re-election year. So that
project.
something we've talked about before that's kind of having to take a back seat for a little while. So some of those people can focus on that instead. But we hope to get that moving again soon and getting a lot of people to the table to start discussing more juvenile defense standards and improving that system in Kansas. Those are all the major updates I have for you today, but I'd be happy to take any questions if there are any.
All right, thank you, Matthew. Questions for him? Steve?
Matthew, I do
Yeah.
have one question for you. Do any of the grants that you have do any work with kids who are truant, or is it strictly just those JO kids?
So truancy could be seen as a criminogenic risk, so it could be used to address those. The basic standards are they would have to be justice involved. And if not justice involved, they have to have an assessment done through DCF that does their, the name escapes me, but it's their basic assessment that they do. And then a referral would have to come from DCF for that.
Perfect.
So those are kind of the two basic standards that have to qualify.
Further questions for Matthew? Hearing none, Matt, thank you for your presentation. Next up is Amanda Peterson from Department of Ed. Good morning, Amanda. Do you
Morning,
have your
everybody.
sidekick with you? I saw him briefly earlier.
It is nap time for my sidekick. For those of you who don't know, one of our family-friendly workplace policies here at the Kansas State Department of Education is an Infants at Work program. And I'm very sad that we don't have an in-person meeting today because you all don't get to meet my wonderful 4.5-month-old. But he is, fingers crossed, happily snoozing for at least the next 5 minutes or so. We have a lot going on. It's back to school season and it's already August, which is incredible. But I wanted to share just 3 pieces with you all today. First, the Kansas Early Learning Standards. So the Kansas Children's Cabinet and Trust Fund and the Kansas State Board of Education both adopted updates to the Kansas Early Learning Standards in February of this year. And while it was certainly an incredible and an intense amount of work to go through and review and update all of those standards, now that they're adopted, the fun work really begins. We get to work to make them available so that early childhood professionals all across the state can incorporate these updated standards as to what we would expect young children to know and be able to do into their day-to-day work. These are very much not standards that we just want to sit on a shelf or to live on a website. They're intended to be used in early childhood programs. And so a couple of really exciting updates on that front. One, I'm very appreciative, or we're all very appreciative of the Children's Cabinet and Trust Fund, who is able to print and mail those standards out to early childhood professionals all around the state through some funding available. So that work is underway. We're really excited that those are going to be hitting the mail soon. And as we have people getting back to school, we know that excitement is building for people to get hard copies of those updated standards in hand. We're also excited that through this partnership, we're going to be able to translate the Kansas Early Learning Standards into Spanish so that they're available for our Spanish-speaking early childhood professionals. We're also excited that there is a new website that's launched. It's KELS.KSDE.org. And at this website, we're able to house the standards, but also all of the accompanying resources that didn't belong in the actual standards document, but can help professionals incorporate them into their work. Things like showing alignments between the standards and commonly used curricula or other tools that might be used in early childhood programs. This website is also able to direct people to trainings, and Kansas Child Care Training Opportunities, or CASITO, has already updated their Kansas Early Learning Standards training to incorporate the updated standards. So that is a training that's available for early childhood professionals who are looking for good professional learning on this topic. So plenty more work to come on this in the coming months and years, but we are excited about this work that's underway. We also, as it's the start of the school year, it is full Kansas kindergarten readiness snapshot season. Since 2018, all elementary schools in Kansas have been required to partner with families of incoming kindergartners, because we know that that milestone of the beginning of the kindergarten year is such an important point in a child's educational journey. So schools are able to partner with parents to be able to complete these questionnaires so that schools can better understand parents' perspectives and gather that information about where children's strengths are and where there might be additional areas for support. It's a really terrific opportunity to build relationships between schools and families, and to help educate families about those activities that they might be able to do at home that can support and reinforce some of the skills that children will be learning in school. In Kansas, we use the Ages and Stages questionnaires, or the ASQ, for this purpose. And if that sounds familiar to all of you, the ASQ is a tool that can be used birth through kindergarten entry. There's multiple versions of the questionnaires, because we know that getting ready for the start of kindergarten happens long before July and August, before the start of a kindergarten year. And we want to make sure that we are identifying areas of need and providing services as early as possible. So while it's used in school settings for this kindergarten readiness snapshot, it's used across our early childhood system to be able to be a developmental screening tool and an opportunity to partner with families long before that. And then finally, I know I've been sharing with you information about the ways that we as a state agency are working to update and improve our state system of accreditation for schools. That is, we are excited to be rolling that out in this coming school year. And as a reminder, that system of accreditation and school improvement is going to focus on what we call the 4 fundamentals. So structured literacy, a balanced assessment system, quality instruction, and standards alignment, as things that we know are important to being able to support children's growth and learning throughout their educational journey. We want to make sure that an accreditation system is well-focused and well-designed on being able to improve outcomes for students. And so this system is going to allow schools to come together to engage in facilitated conversation with their peers to develop action plans that can serve as the basis for their school accreditation. So work is underway. We have just launched our first training for the individuals who will be facilitating these sessions last week. That's going really well. We've got a lot to do, and we've got a lot of informational sessions scheduled for schools and to be able to come together and learn more about what they're going to be expected to do for this coming year. We're really excited that early childhood and kindergarten readiness are well aligned and well incorporated into this, because we know that those fundamentals of effective instruction are things that, again, begin before kindergarten, and we want schools to be thinking about their overall pre-K through 12 system. So I'm glad to answer questions about any of that, and I'll also share some links with more detail following this meeting.
All right, thank you, Amanda. Questions or input, board members? All right, hearing none. Thank you, Amanda.
You're welcome.
We'll move on to Dina Russell Marino on behalf of the Kansas Supreme Court.
Good morning and thank you. My updates are short. We do have best practices in child welfare law training happening in August 20th and 21st. This is a biannual training that we offer to all of our partner agencies, but it's focused on our legal and judicial communities. This training will be focused on termination of parental rights and permanency options for children. If you'd like to register for that training, I'll send Lindsay the link to register in the chat, and then however you all normally send that out, that would be great. The next training after that one will be April 15th and 16th, and that one will be focused on trauma-informed courtrooms. And then we'll have another training next spring on the Indian Child Welfare Act. And that's just really an effort for us to make sure that our courts are providing the best possible service for all children and families who come before us. We also are launching family treatment courts this fall. The pilot programs will be launched in Miami County, Lyon County, and Cowley County. The family treatment courts are specialty courts that are designed to assist with cases where there are severe mental illness or substance abuse by the parents or the children in an effort to see faster and more successful permanency options for those cases. So we're looking forward to seeing how that will work. We've done a lot of work over the last couple of years, meeting with similar programs in Iowa and Oklahoma, and shadowing them and seeing how they do things. And they've had some great successes. So we're really looking forward to how that can translate here in Kansas. And then finally, just to let all of you know, we also have standards for CASA and CRB programs across the state. Both of those programs use volunteers to either advocate for or make recommendations to the court on children in need of care cases, so abused and neglected children. In the past, we've always had standards that have required certain training topics, but we've now developed a training manual for CRB programs. CASA programs get theirs from their national association, but CRB programs, Citizen Review Board programs, don't have that same national organization. So the Office of Judicial Administration has worked with subject matter experts to put together a manual for those volunteers so that their training is now more standardized. And that manual was launched in July. Apart from that, we really don't have a lot of updates for you, but if there are any questions, I'm happy to answer them.
All
This is
right, thank you,
Monica.
Dina.
Dina, I have a quick question. Could you restate who the training is for the first two that you mentioned, the termination of rights and the trauma-informed care? Is that just for court staff?
It's not. So it is geared toward our legal community. You apply for CLE for that, so continuing legal education, but it's open to any child welfare partner. And we hope that you guys will come or at least pass along that registration information because it is valuable information. We will have this in August, we will have a focus on permanency options, including the new permanency option, which is sole family legal permanency. And we will have Jay Rajaraman from the American Bar Association talking about how we can take a different look at termination of parental rights by front-loading services to prevent termination and then having better preparation for termination when it occurs so that children can reach permanency more quickly. We will also have DCF there reviewing their CFSR results and giving some ideas about how we can improve those CFSR results, which a lot of that is contained in DCF's program improvement plan. So we do encourage anyone who's interested in coming to come. Each session has its own registration link. So if some of them interest you and not others, you're welcome to just register for whichever ones you'd like to attend.
Okay, further questions for Dina? Hearing none, Dina, thank you for your update.
Thank you.
Don, I don't believe that DCF or Board of Regents are on the call with us. If I am wrong, speak now, but I don't see either Carla or Carla. I do know Kansas Board of Regents, there was legislation passed to create terminology escapes me, working group, we'll call it, focused on the blueprint for literacy. So that committee has been convened and they've started their work. It will be aimed at the teacher prep primarily at our schools of education in Kansas, so that we are graduating new teachers who have this training. I think there's been training underway in the last several years for teachers already in the workforce to try and help address the way reading is taught is my understanding. So my very limited understanding. Beyond that, I didn't receive any updates from Board of Regents. And DCF is at the table with us partnering. Work continues on the Kansas Early Childhood Workforce Registry for the provider community to use to track their professional development. We're making good progress. And implementation should be happening this fall. And that is one of many things they're involved in, but one that I have working knowledge of from the cabinet perspective. So if there are further updates from either of those agencies, we always include the agency updates in our minutes. If there are links and things that need to be emailed out to the board, we will get that out to you as soon as those are provided. So I think we can move on, Don.
Okay, we'll proceed with the director's update then.
Okay, well, it's been, I keep hoping for a slow season and there's no such thing here. We have been incredibly busy with a number of different stages of the process since we last met in June. So earlier this week, we submitted a new application for a renewal of the preschool development grant to the Federal Administration for Children and Families. Those decisions will be made before the end of September, and then the grant will follow effectively the federal fiscal year, give or take a day, because the grant period is September 30th, 24, annually cycling in 1 year increments for 3 total years. Kansas was eligible to apply for $7 million per year. So we submitted an application for that maximum amount of funding. If past experience is any guide, they typically have adjusted down, and we've had to make budget and plan adjustments, but we are hopeful that we can successfully land the grant award to continue the work that is encompassed by the All In for Kansas Kids strategic plan. We had a 3-year preschool development grant renewal grant that just ended the end of April, and we have submitted the final quarterly report, and we are in the final closeout process. And successfully, thanks to all the partners that had a piece of the work, we succeeded in spending that grant to zero. So every dollar mattered and has been incredibly helpful. We also have a 1-year PDG planning grant. We are in a no-cost extension period to wrap up the strategic plan and a couple other projects. The key project that is still underway is an expansion of the project known as Baby Steps, which is a financial incentive for childcare providers, home-based providers, to take in more infants. So this is infant slots they are licensed to fill that they, for a variety of reasons, haven't been filling. We have seen great success. The Patterson Family Foundation funds Baby Steps in rural communities across the state. We expanded into the urban core in Wyandotte County and Atchison and a couple communities in Northeast Kansas. We have full enrollment with 44 providers, adding 45 new infant slots. So it's proving to be successful. The Child Care Capacity Accelerator will be the topic of a more detailed presentation at our October meeting. We want to bring you updates. We have wrapped up most, not all, but we are in the final phase of site visits to go out and see what's happening with construction and expansion of childcare facilities. And so we'll have reporting from those site visits and the reports that the grantees have turned in. That funding program was a complicated package of multiple funding sources braided together. 2 of those funding sources are complete as of June 30th, 2024. The funding cycle ended for $31 million worth of funding that DCF provided from their American Rescue Plan Child Care Development discretionary funding, so pandemic relief funds that were not tied to the child care subsidy program, but the discretionary aspect was gave us latitude to craft a program that helped underwrite major startup costs and hiring costs and training and that sort of thing. So we are processing final payments and are very pleased with the success of those funds. The preschool development grant planning grant awarded a slate of innovation community grants, and that work is wrapped up as of June 30th as well. So those were pilots, the community level, that, you know, we're just allowing communities to test new strategies for expanding childcare opportunities in their communities. Several things were incredibly successful. Some were disappointingly less successful, but we learned a lot from all of that work. So we're excited to bring that reporting to you. And then we are working, part of this is testing a number of different styles of public-private partnerships. So we'll give you lots more information in October at that meeting. The Imagination Library project is going well. We have over 75,000 children statewide are enrolled. We have a number of communities that have exceeded the 65% enrollment goal, and we are working to support those community, the communities across the state in helping make sure parents have access to the program. One of the things that we are engaged in is a partnership with the Kansas chapter of the American Association of Pediatricians to put a poster in their member pediatrician offices across the state that includes a QR code to help parents sign up for the program. The pediatricians in Kansas have their own program called Turn a Page, Touch a Mind. And that is the main part of the poster is information related to Turn a Page, Touch a Mind. But we have been working for some time to figure out how we can complement each other. So their program provides parents at well checkups, the children are provided a book when they visit the doctor for a well checkup. And our program then, as you know, offers the parents the opportunity to sign up to receive a book a month for the first 5 years. So we think there's good synergy. There's other partnerships brewing that could be exciting for us. And the 501c3, the Imagination Library of Kansas, is up and running. So if you're listening and you feel like supporting the program, the donations to the Imagination Library of Kansas are tax deductible as charitable contributions. It's a nonprofit foundation, and there's more information on our website. So, Dawn, I think I'll leave it there and turn it back to you. Unless there are questions, I'm happy to entertain any questions or discussion.
All right, thank you, Melissa. Questions from anyone? All right, hearing none. Our next agenda item and final agenda item is discussion about October meeting. As you know, we initially intended that this meeting would be in person. That didn't come together, and well, as we see by virtual attendance today, we're not at full force. We were not going to be at full force if we met in person. There still is an appetite among several board members that we do try to have an in-person meeting. So Melissa, are you still aiming at potentially October for in-person?
It makes sense to me. If we are able to meet in person in October, we'll receive the accountability, the Early Childhood Block Grant accountability report. We will we'll talk about the new RFP for the ECBG grant making cycle. We will have the accelerator updates. And then as a board, we can, when the business of the meeting adjourns, I would love for us to have a board retreat. And it's an opportunity. We don't meet in person, but about once a year, but it's a good opportunity for us to convene and work in person together and goal set and things like that. So I don't know how to do it because we thought we had attendance availability for this meeting, and that didn't turn out to be the case.
Mr. Chair,
So,
I would suggest we just go ahead and do what we did before and plan to have an in-person and get it on everybody's calendars now. And, if circumstances change and we can't do it, but I'd like for us to go ahead and shoot for that October meeting
that would be
if
great.
others are interested.
I like that idea too. This is Leetta.
Perfect.
All right, that would be my inclination as well. So let's aim for in person in October.
Okay.
And see if we can reach critical mass. And if not, just like we did this month, we will pivot back to virtual.
Okay, we will check on location, but we will send a calendar hold today to get the block on the calendar, and then we'll send more detail once we determine if the facility is available. stay tuned.
All right, sounds good. So the date for that October meeting will be October 4th. The first
Friday, October
day in
4th.
October.
Yep.
All right, is there any further business to come before the board? All right, well, as we close, I just want to thank Melissa, Melissa and her staff for the continuing good work on behalf of the children of Kansas. I think this is a wonderful resource for the state, and I'm just pleased to be a small part of it. You folks on staff do the work, along with the support from the folks at KU, and we really appreciate it. So thank you, everyone, and thank you to board members for your attendance and input as well. With that, I will declare the meeting adjourned, and we will see you in October.
Thank you.
Thank you, everyone.